The commonly known condition, attention deficit hyperactivity disorder, or ADHD, is a growing behavioral condition for both adults and children, has become one of the main targets of modern healthcare. The fact that ADHD exists in children in even greater numbers than in adults illustrates the urgency with which this disorder must be handled. The important thing to know is that ADHD is possible to surmount. Many individuals with ADHD have led very successful and satisfying lives, but early identification and solution development offer a big advantage. The longer this condition persists, the more serious the consequences, such as family and social stress, delinquency, school failure, depression, addiction, and job loss. The ability to pay attention and learn things that are necessary for one's everyday survival is the basis of a good and healthy life. There are currently two mainstream approaches to dealing with ADHD. One is behavioral therapy, and the other is medication. Behavioral therapy is minimally effective because it doesn't address the underlying dysregulation in the brain. And medication has supplied some results, but too often at a high price, because the effects of ingesting a psychostimulant is that by nature of being a chemical, has other side effects, such as dependency, as well as physiological arousal of other systems of the body, which often has lasting consequences, especially when it comes to the developing bodies of children and adolescents. How it begins is that when a client first comes on board at BrainXL, neurofeedback technology allows us to identify specific performance markers of ADHD. Electroencephalogram, or EEG, as it is often referred to, is the measure of brain waves that different regions of the brain emit. When it comes to ADHD, there's a classical signature of electrical activity that is associated with the condition referred to as the theta-beta ratio. One of the most iconic and senior researchers in the field of neurofeedback, the psychologist and EEG technician Dr. Joel Lubar from the University of Tennessee, found that what this theta-beta ratio shows is that in individuals who report symptoms of ADHD, show that the amount of slow theta brainwaves exceeds the amount of fast beta brainwaves in the frontal lobes by more than twofold. This has been reported with a whopping 98% accuracy and has become an FDA-approved marker for the diagnosis of ADHD. Of course, not all cases of ADHD present this theta-beta ratio discrepancy because the brain is highly individualized and unique from person to person. The important takeaway is that however ADHD shows up in a person's brain can be identified and trained with neurofeedback. The way that neurofeedback helps the brain perform better is that by working at the level of regulating electrical activity of the brain, neurofeedback allows it to learn how to function more efficiently by shifting its activity towards the parameters that correspond to better focus, impulse control, reduction of restlessness, irritability, aggression, and a host of other symptoms that are seen in ADHD cases. Specifically, it has been the sensory motor rhythm, or SMR, which is a specific brainwave frequency that's been researched extensively in the application of neurofeedback. This frequency of 12 to 15 hertz, or cycles per second, has been shown to be the most effective frequency band to train individuals with ADHD. If you would like more information, please give us a call or schedule a free consultation in the link on this page. We look forward to hearing from you soon. Thank you.